Welcome back. Woo! We're learning a lot here on this segment. We're still talking about oral ulcers. And you can call in with any questions you have on the topic. The number to call is 0808-054-2233. Once again, that's 0808-054-2233. You can also tweet at CTV_Mary A. And if it gets in time, it could be read. We were talking about the recurrent ulcers, scars. What does this do to the mouth?
Well, herpes, if you're talking about herpes labialis, usually heals without scarring. That's why you will not always see a patch on the lip after somebody have had like 20 recurrence. So it doesn't usually heal with scarring. But where it is very severe, like you have it in patients with HIV, that will be a very severe ulceration. May have some scars, but not really significant.
Okay, so what about the aphthous ulcers?
Okay, aphthous ulcers are recurrent ulcers. Usually it could be caused by autoimmune conditions, stress, hematological deficiencies, example anemia. The patient is low in nutrients. So those are usually will appear as small, tiny ulcers in the mouth. It could be cups of 1 to 6 at a time. Then you could have it on all over the mouth, but there are some certain areas that you will not find aphthous ulcers in the mouth, like the hard palate or the dorsum of the tongue. But usually the aphthous, that's the surface of the tongue. Now, for aphthous, there are 3 types. We have the minor, we have the major, the herpetiform type. Now, the minor and the major, the difference is size. Minor is usually very small, less than 1 cm, where larger than 1 cm is for the major. So the size is what determines the difference in the minor and the major.
Let's quickly take this call. Hello, Emmanuel. Are you there? Hello, Emmanuel. We've lost Emmanuel. So try again, Emmanuel. You were talking about...
Then we have the herpetiform type, where you have over 100 ulcers in the mouth.
100 ulcers at once?
At once, all over the mouth.
That would be so
painful. Then it will now coalesce, those tiny ones will coalesce and become bigger ulcers. They are so painful. Even one tiny aphthous is so painful, talk less of having so many. So you could have that as well.
So when that heals, does it form a scar?
No. Usually aphthous heals without scarification.
Okay.
So usually it will do, everything just heals off. That's what it is.
You know, I've heard mothers say, come on, eat your food. You know, when the food is hot and spicy, that's when the thing heals. How true is this?
That is not true. Because even heat will cause more ulcers. We call thermal burns. Like if you eat hot pizza or anything.
Let me just hold you there and take Chris. We'll talk about this later. Hello, Chris.
Please, my question is, this happens simplest. Is this only on the mouth, around the lip that it stays? And must it always be there?
Okay, thank you, Chris. Thank you, Chris. I know you've already educated us on 2 types of herpes simplex, but go ahead.
Well, for the herpes simplex, we have mentioned already that we have the primary infection, which happens in children. Then the secondary infection is the one that now keeps coming. That's the one you see on the lip. Sometimes you can see it on the base of the nose. That is for the type 1. Then, of course, we mentioned the ones that can have in the genital area. That's the type 2.
So they're totally different. And then he's asking, does it have to happen?
Well, people go through a lot of stress. There's malnutrition because of our economy. People would tend to eat gari 3 times a day.
Okay,
you know, so there's no balanced diet. So nutrition will bring down the immunity. Old age will bring down the immunity. You know, and then other underlying medical conditions like diabetes, what they call it, HIV. Maybe a patient is going through chemotherapy.
Then you spoke about stress. What does stress have to do with it?
Now, stress has a lot to do with oral ulcers.
You know, we are sharing this time with callers, so let me hold you there. Hello.
Hello, good morning.
Good morning, Mr. Boboye.
Please, I just on my television now. But there's something I want to ask the doctor. Can I ask him?
Please go ahead.
Can a diabetes patient eat ofada rice?
Okay, thank you. But we are talking about dental problems now.
Has been bothering me for a long time.
I think at least I could contribute to that.
Okay.
Ofada rice have been known to be a very, very healthy type of rice. Ofada rice is very healthy. Many people actually do advocate ofada than the normal white rice that we eat because it's less starchy compared to the white rice. So if you're diabetic, I think the first thing first is to ask your physician, find out if you can eat ofada rice at all. But if you're going to choose out of the normal white rice and your fada, I think your fada is even better.
Okay, thank you, Mrs. Boboye, but we won't be entertaining any more questions that are not about oral ulcers or oral sores. So we are going on ahead about oral sores, and I wanted to ask now, how do you treat oral sores? You mentioned salt and water that people can use, assuming it's the aphthous ulcer that is not so serious. What do they do?
Okay, if it's aphthous, salt and water is just okay. Maybe one ulcer, tiny, small one in the mouth, one water and salt. Everybody knows that. So many, they just go ahead and do it. But if it's not healing, then you need to come to the hospital. There are some other agents we can use that prevents pain, which are anesthetic pastes that we can write for you. You just apply it and remove the pain. You can eat up until the ulcers heals up.
Okay, let's take the last call for the day. Hello, Margaret. Okay, we lost Margaret. Now, what sorts of I know that a balanced diet is necessary, but what usually is missing when you talk of malnutrition and susceptibility to oral sores?
Okay, iron helps with blood, and we need the patient to have enough blood, because when there's anemia, which is a reduction in the blood, it can result predisposed to aphthous ulcers or any other ulcer. So iron is important in our diet. A lot of vegetables, because that contains a lot of iron and vitamins, which also help with the integrity of the oral mucosa. That's the lining of the mouth. So vitamin C is very needful, which we get a lot in our fruits. So that's also very important. It could help with healing, help to rebuild the tissues. And then protein diet is also very important because that helps with building up. So our proteins, vitamins, fruits, vegetables, all that is very important in our diet.
Okay, and one must not ignore, correct me if I'm wrong, one must not ignore an oral sore.
Yes.
So what you do now, you study it, but it's not like you have to rush to the hospital. But what if it's in a child?
Yeah.
Will we be forgiven? I mean, if the child just says, pain in the mouth, you see it sore, and you rush to the hospital.
You know, it's relative. If you have one oral ulcer, 1 in 6 months, you're not disturbed, and then you can even tell what caused it. You are writing exams. I mean, by the time that after exams, you're okay. But where it is becoming frequent, you're having it every month or every 2 weeks, even every week, then you need to see the doctor on that.
Okay, how do you handle oral hygiene when somebody has had, for example, the herpetiform type, where it's like one huge sore all over the mouth? How do you handle that?
It will be difficult to brush at that point in time. Warm water and salt is very helpful. It actually also cleans out the bacteria and all that, and we do it so very often. We do up to 6 times in a day. That enough helps to get rid of the bacteria in the mouth. Then you can use cotton wool. It's maybe bland toothpaste, not the kind of toothpaste that are bland, so that it won't cause some peppery sensations in the mouth. So we can go ahead and do that. Mouthwashes, Clexidine mouthwash. There's so many different types of good mouthwashes that you can use to rinse out the mouth. So
okay, so I remember we're talking about food, and you said hot and spicy foods make it worse.
Yeah.
So those are things to avoid.
Yeah, bland, warm food. Normally, even if you don't have ulcers, you shouldn't take very hot food, or it's going to cause ulcers.
But I thought that there was room for, what they call cauterizing. When the
food will not cauterize it. Now we have agents that cauterizes ulcers.
Okay.
That one you will not get on the counter. you need to come to the dentist. We have the cauterizing agents. Once we cauterize the lesions, it heals up without pain. So immediately we cauterize it, you don't feel pain. Those are the things we do to treat, to treat the ulcers when you come to the dentist.
Thank you very much for this. And I must tell you, my greatest takeaway is that fever blister.
Fever blister.
What a shock. Thank you so much for coming, Dr. Eweka.
Thank you so very much.
And thank you so much for being with us. I'm sure you've gained a lot. I have. Have a great weekend. I'm Mary Alale Yusuf.